We're now seeing what can only be called the start of the UK's coronavirus epidemic. Cases of the virus are passing from person to person without established links to travel overseas or other infected people. A fact so cruelly underlined today by the first death in Britain from the virus. The patient at the Royal Berkshire Hospital had no known contact with an existing case.
Our sympathies are very much with the victim and their family. But the situation is pretty much as it has been. In something like this, what the scientists say is that you've got a range of things that you can do to arrest or check the spread of a disease, but you can't fire your shots too early. It's all about the timing.
That timing is likely to be dictated by the virus, not the PM or his ministers, but their plan includes discrete phases. The containment phase was focused on detecting and isolating early cases, but now they're moving into the delay phase, which could see things like school closures, more working from home and fewer large-scale gatherings. The final phase is dubbed mitigation, where the focus is on care, supporting hospitals and minimising the impact on society. Earlier today, the Chief Medical Officer warned MPs that according to their modelling, the NHS may not have the capacity to cope.
We will get 50% of all the cases over a 3-week period and 95% of the cases over a 9-week period, if it follows the trajectory we think it's likely to. We will try and shift as far as possible, shift things out of the main hospital system. And the bit of the system which will come under pressure first will be those conditions that require people to have oxygen and particularly to have critical care beds. And that bit, I think, will come under pressure at quite an early stage if we have a high end of the range epidemic.
Of the UK's current 116 cases, at least 10 are what's called community acquired, with no known links to others. Some were detected by testing in hospitals of patients with acute lung disease. Others were screened by GPs. They show the virus is moving undetected.
When you don't know who the source of infection is, it becomes much more difficult. Cases still need to be identified, and epidemiologists in Public Health England will be looking carefully at where the cases are emerging.
There will come a point, and perhaps soon, when the number of cases exceeds our ability to trace them, but for the time being, it could slow the outbreak and buy the NHS and wider society valuable time.